Hey everyone, it's Dr. Jason West and the 5 o'clock live, and this is going to be one of the best lives that we've done. It's so good and so important information of chronic health problems, pain, organ dysfunction, chronic regional pain syndrome. And anyway, we've worked so hard on this show. I'm so excited. We have a report ready to go that you can get for free. You just pick up in the comments, hashtag SCARS, or we're going to give you a link in just a minute. But if you have a chronic health problem, I am so excited to share with you how we can help you. And it's amazing. And it's an all-natural therapy. It's called neurotherapy, but it has to do with scar tissue. So Dr. Jason West, live at 5, where we're showing you healthcare tips to be healthier. And this is probably my favorite one, because if I was stuck on a desert island and they said you can only take one treatment therapy with you, man, I think that neurotherapy and scar therapy in particular is so important. So if you're just joining us, it's the Dr. West Live at 5 program, all about scar therapy. And we're going over the whole thing of why scars are so important, why they're interference fields, where they are. You know, you can have a scar on different parts of your body and it'll help you to get rid of chronic headaches. Or you can have scar right on top of your head or in your tonsils, or have a mastoid scar right here, and you treat the scar and all of a sudden people feel liberated. It is so fun to teach about this therapy. And so it's Dr. West Live at 5. I got to get my advance so that we can talk about this. So every week we're on Facebook, we're on YouTube, and we put this into our podcast library. Again, if you'll see right over here, hashtag SCARS, or here's a link, we're going to put it in the description in our Facebook and our YouTube report. But man, have we got some just dynamite information for you. And the biggest thing is with scars. So when your skin gets cut, results from an injury, what happens is you have these sympathetic nerve fibers that basically they try and heal. And it disrupts the overall function of the autonomic nervous system. It interferes with acupuncture meridians, and basically it creates a chaotic, noisy, sympathetic nerve activity. And let me tell you, this is one of the neatest things that I've learned, and I see so many important outcomes that come with this. It's scar therapy. So again, I've got all the information in a really neat report. Matter of fact, Caden, let's show everybody where the report is. If you'll switch me over to the iPad. I'm really excited about this. We put in the neurotherapy report. You can get it if you go to the link, or if you type in hashtag SCARS, and we'll pick up the neurotherapy, where it comes from, Germany in the 1920s, how we treat it. It's just a bonanza of good information. It's 13 pages that we've put together in a free report, and why the autonomic nervous system, how you can have a Huneke phenomenon. I love this picture right here that shows about the neurotransmitters, and also some examples of scar tissue. And Caden, let's come back and pick me up here. One of the things that I'm always looking for, breakthrough ways to help people to get better. And one of the first things I learned, so I learned about this in 2005, 2006. I had a patient that come in that had 7 back surgeries. And she was just so much pain and discomfort in her back. And the surgeon didn't want to do any more surgery. And we were doing acupuncture therapies. We were trying to reset the muscles. We were giving all the nutrition that she needed. She just wasn't responding. And one day, kind of out of desperation, I said, hey, when did this all start? And where does it hurt? And she's like, you know what? And this was surgery on her low back. She said, look, I have a scar right here. And it was where they had taken out a lipoma, which is a benign area of fat tissue. They made a little incision and pulled it out. And we treated those scars, and her back pain resolved. It was such an amazing thing. And I love this picture right here, because scars are islands of turbulence. A neurologist, Dr. Hushman, refers to this as scars. It just creates chaos in the body. And it's so important that you find a doctor that recognizes the importance of scar therapy and can reset therapies. Now, I'm going to talk about how you can reset these at home, as well as you can get specific in-office treatments. Again, it's all in our SCAR report. You can pick it up at hashtag SCARS. So if you're just joining us, we're talking about one of the most important ways to help you to achieve and maintain optimal health so that you live here, not here. And this is so neglected, and there's so many different fun things that you can do is when you start to recognize this. So what I tell people is, where disease comes from is energy. Now, what do I mean by that? It's a lack of energy. In Dr. Levy's book, Curing the Incurable, if you condense the book down, it's all about vitamin C therapy, 1,200 different treatments, different studies that show that really that vitamin C is an electron donor. And that's why people, when they call the office and they're saying, can you help with fibromyalgia? And I'm like, yes, I think we can really help with that. Can you help with arthritis? Can you help with migraine headaches? Can you help with infertility? Can you help with stomach problems? Can you help with fatigue? And the answer is, like, if we get energy into your system and vitamin C is the electron donor, oh my gosh, we get some really amazing outcomes, and this is no different. And the other neat thing about scars is they harbor emotions. That's why I put this graphic in. You see all these different things of happiness, of sadness. I've seen scars, like if it's been a trauma from a motor vehicle accident, or it was a difficult labor, or if it was a cancer removal. And what happens is people frequently harbor those emotions with that scar, and as the energy meridians go through the body, they hit that scar tissue, and it's like they're dammed or they're blocked, and the energy can't flow in the body. And if you liberate the scar, what happens is that not only do you feel emotionally better, it's helpful for pain, it's helpful for trauma. I've seen so many organ systems improve. Liver function, kidney function. I've seen stomach problems go away. I've seen migraine headaches dissipate. There's so many applications for PCOS, for dysmenorrhea, for irregular cycles, heavy cycles. There's an application for male health. Like, this is awesome. It's just, I get really passionate about it because this is really, really fun. So when we start talking about scar therapy, I found this picture. I got to kind of get out of the way. You see this lady here that's with handcuffs. And the reason why I put it there is because when you liberate scars, so many emotional things can happen. Anxiety and depression can improve. Cyclic mood disorders can improve. People that are just not responsive for ADD and ADH therapy really improve from this. And when you treat the scars, many times you get what's called a Huneke phenomenon, and it's named after a father-son combination that basically put this together, recognized that there was a significant problem with scar tissue. And so you got to release the scars here. I'm going the wrong direction. So here it is. During scar formation, adhesions attach to the deeper sliding structures, such as the tendons and muscles, and it makes it so the areas don't move very well. And this was put together by a French surgeon that has some scars, or videos on scars that show adhesions, and you can observe during surgeries. And I put this zipper picture in here because among the fascinating clips that Dr. Jacques showed was that the scar attachment and restricting of the sliding motion, which affects the fascia, which is the layer in between the skin and the muscles. He also showed how that you can get adhesions from C-section scars, which so many times, if you treat the C-section scar with the way I'm going to tell you, or find someone that can treat you that way, there's so many pelvic things that improve for females. So the scar tissue is a natural repair by the body of the wound, and basically what happens is you get this dense fibrous connective tissue that comes together almost like a zipper, and wounds heal differently than normal tissue. So you get that collagen formation, but it has different functional qualities than normal tissue. So hey everyone, if you're just joining us, it's the Dr. West at 5 live program. We're doing it about scar therapy. If you don't know about scar therapy and you have a chronic health condition, I am so excited to share this information with you. We put together a free report. You can pick it up in #scars. But also we're talking about what scars do to the body. It restricts motion. It interferes with normal physiologic processes. The nerves, the blood, the lymphatic vessels, the meridians, the skin, the fascia, that can all be involved in that scar barrier. And the other thing is it can throw off your temperature, because the temperatures of the scars can vary plus or minus 2 degrees, and the electrical resistance is found to be about 10 times higher than normal skin. So if you've had a mole removed, if you've had a laparoscopy, a C-section, if you've had any type of surgery, or a motorcycle injury, which we're going to see in just a second. Luckily, I have 5 sons. We love to ride motorcycles. I've got 2 of them that have donated their bodies to science, specifically this video. One to show you what a treated scar looks like, and then a scar that we're going to treat. And we're going to treat it with a natural B vitamin solution. And what it does is it literally makes the scar resistance open and close and reset. And the scars are such a huge pain generator. The subcutaneous tissue, and again, the deeper tissues, and so nerve entrapment, neuromas, inflammatory mediators can all be involved in that scar. We just got to release all of that pent-up energy and get it so the meridians start to flow, and you can get the tissues to literally almost be normal. I'm going to show you on Dalton's leg in just a minute what happens when you treat the scar tissue with the B vitamin program, with wheat germ oil, and there's chlorophyll ointment, and there's DMSO therapy. There's a whole bunch of different ways to do it. Now, my favorite one is the B vitamin program that I'm going to show you in just a minute. But if the tissues aren't moving correctly, you can get what's called fascial drag. And again, that's where all of that connective collagen scar tissue comes together, and it makes it so the tissues don't move very well. And in your assessment, and if you have a scar, you can feel this. I have one on my knee that I'm feeling right now. I broke my kneecap when I was racing motorcycles when I was 15, so over 30 years ago. And when I put my hands out, you can kind of feel the tissue in there. It used to be almost like a keloid scar. It was almost like a worm on top of my kneecap. And I've treated it numerous times with the B vitamin therapy. And it literally, unless you're really looking for it, you can't even really tell. Now, one of the other things that's really neat when you treat scar tissue is areas of pain and discomfort and stuff like that frequently go away. And so it doesn't have to be necessarily in the area of, like if you've had a carpal tunnel surgery, we should be treating your scars. If you've had an accident with, a knife or something like that, and of course I dropped my thing here, my mouse. If you've had an injury with a knife, like at Boy Scout camp, one of my friends had a huge cut on his hand, and it caused some healthcare problems. And I wish I would have known about that therapy now. And for example, but in the literature, 1983, Dr. Upledger found that he could get rid of migraines by treating different scars, and one of them was an appendectomy scar. The other thing that's really important with scar tissue when you're evaluating it is if you're pressing it, you can feel how it's supposed to be sliding, and then there'll kind of be a catch. Another thing that we've seen is when the scars are pressed and stuff, a lot of times it can turn off or decrease headaches. It can have a huge impact, again, on your organ structure. We talk about this all the time in the video. So if you've seen the hundreds of patient testimonials that we have had on our YouTube and our Facebook and our website channel, you'll see people talking about neural therapy. And the neural therapy, literally, you have your central nervous system, and then the peripheral nerves goes out through the organs, and then the muscles and into the skin. And if you reset the skin, what happens is it resets the organs, the muscles, the central nervous system, and the brain. And we talk about it all the time as this nerve reset. Well, when you're feeling scar tissue, many times people will notice that it moves normally in one area and it's really resistant in another area. So this interference field, what it does is it causes a local disturbance in that nervous system loop. And we've seen those in teeth scars, in tonsils, and it's really important as an interference field, especially for chronic health problems. And again, I've seen so many health conditions go away, and there's at-home treatments that you can do for it. I think the B vitamin injection therapy that I'm going to show you in a minute is the most effective. And again, if you're worried about any of the information, you can pick it up in the link or just type in #scar and we'll pick it up. So let's go into more of okay, here we go. So when we're looking at scars, and this is kind of I just wanted a really good one. I hope I'm not grossing anybody out that's looking at this, but you can see how all of that collagen formation, it's just going to be a really big blockage for normal energy flow. And so when we talk about scars, we want to make sure in our workup, if you're seeing a doctor that's aware of scars, all scars are important. Laparoscopic scars, tonsil scars, mole removal scars, surgical scars, episiotomy scars, circumcision scars. And let me tell you, like, I'm not too excited to go running after circumcision scars or episiotomy scars, but if you haven't found relief of your healthcare condition, it's something to consider. I would certainly do the home treatments that I'm going to talk about first. And if those don't work, you can do a specific type of therapy. And if anybody's like, well, wait a minute, I don't want any injections into that area, let me tell you, it's worth it. One of my patient testimonials, you'll see of Jesse, that's on our daily dose vitamin H program. It was life-changing when we treated some serious scar tissue in his pelvic area. And I've seen amazing outcomes for that. And just so you know, I've seen some really good outcomes with this for Peyronie's disease. And it's really only important if you know what Peyronie's disease is, or at least the application for that. So let's just keep going. With scar characteristics, we're talking about how to evaluate scars. If they're painful, if they're itching, sometimes they'll ooze, they just never heal up. And if you liberate that energy and you treat them correctly, you can get almost all scars to heal. That's also really important. If it's a non-tender scar, it may be abnormal thickening, it may be a little bit ticklish. Sometimes people have no sensation. There's temperature changes, there's texture changes, there's color changes. And in the textbook of naturopathic physical medicine, if you start pushing on the scars, a lot of times you'll feel a lack of end feel. So the tissues should move. You should have that fascial movement. So many times scars will prevent movement, and what it does is it just causes a focus. So the palpation is so important. I think it's one of the things that's lost in traditional medicine is they're not touching people enough. You get so much diagnostic information with your hands, because if you palpate the scars and the tender spots or these small neuromas, and then you apply treatments to it, chronic health problems improve. So you need to trust your intuition. The doctor needs to trust the intuition. So let's start talking about scar treatments. So here's a couple different ways that you can help them. Like one, for years I did acupuncture treatments where you put a needle at the beginning of the scar and a needle at the end of the scar, and then you kind of do a railroad track. I think that's really effective. I also think rubbing the scars and getting them to move better is really important. Literally myofascial release therapy, and then neural prolotherapy. You can use a 5% dextrose or a mannitol, which is a sugar solution. It bathes the nerve endings. It's really good for turning off chronic pain patterns. Also the topical treatments, and these are the things I love to recommend for people at home. Wheat germ oil, EDAP cream, which is vitamins E, D, A, and it has a phosphorus component to it. Unsaturated fatty acid or chlorophyll ointments. Aloe vera, I didn't write that up, is really good. You take those and rub out your scars. My favorite therapy is the neural therapy. That's the B vitamin that I'm going to demonstrate in just a minute. And then really aggressive therapy, you can use glutathione, which is a really powerful antioxidant and gets rid of toxins. Or refined tree sap, also known as dimethyl sulfur oxide. It's a universal softener. It's a wonderful therapy for scar tissue. You can get it over the counter. You can also, there's an application for an IV treatment. Just the only downside of DMSO therapy is it kind of makes you smell like garlic or cream corn. So my favorite therapy, B vitamin therapy, a para-aminobenzoic acid, and what it does is it really helps to create an improvement in the fight or flight response, and it creates a lightning phenomenon. Now I'm going to have to move over here because I wanted everybody to see the lightning component. But what that means is that you can really, really help by doing this B vitamin therapy. Now, I have a couple questions over here. Kevin says, how about scars inside the lung? So Kevin, obviously it's going to be hard to inject that area, if not impossible, but I would absolutely be using the IV protocols of the DMSO therapy and the para-aminobenzoic acid. And the PABA, it's a glycolized ester, and what it does is it makes your nerve endings open and close and reset. It's in a book called The Manual of Neural Therapy. It's just miraculous for internal scar tissue. And we can add the DMSO to that, and it is amazing. Now, another question that I had was about the chickenpox scars from my friend in Missouri, Rebecca Austin. Hi, Rebecca. And yes, those can be significant interference fields as well. It's not something that I always start off with chickenpox scars or acne scars. I'm usually looking for incision scars, again, mole removal, knee surgery, hip surgery, any laparoscopic scars, C-section scars are really important. Cosmetic scars for breast augmentation stuff are really important to treat. And a lot of times people forget about the scars, especially with a lot of men have a lot of hand scars. Women can have sewing scars, they can have kitchen scars, they can have their employment scars. But if you have those scars on your hands, like, they're absolutely worth treating. And so I'm going to switch over. I want to show you guys two motorcycle scars. And again, I really enjoy riding motorcycles with my sons. One we haven't treated, and then one that we have treated. So we're going to start off with the treated scar first. So this is my son Dalton. And so we're going to go over, we're going to switch cameras here, and we're going to show this scar right here on his leg. Of course, you can't even hardly see it. I mean, I have to actually feel it. Dalton, oh, here it is, right here. So here is his motorcycle scar. He was standing on the side of a trail, and one of his friends came and hit him with the foot peg, and it was like an ice cream scoop. And it was a really angry purple, almost like a keloid score that was raised. We treated it with the B vitamin solution, and you can't even see it anymore. I actually had him come in. I was going to inject this scar right here, and then I said, well, you can't even see it. So we have a better scar. So we got Caden to come in, and he's going to donate his body to science. And we're going to show you what, and he had a motorcycle scar where it's just ripped up the side of his ankle. It's purple, and we're going to be able to show that. So here's what we want to do on this scar. I want to show everybody what the scar looks like. Now, Caden isn't reporting to me any significant health care concerns. Maybe we can get him to sleep a little bit better and help his concentration, some other things. And so as you palpate the scar, it doesn't track right. I mean, if you see normal skin over here, see how you can move it through the fascial planes? We come up to the scar tissue, and like, it's stuck. It doesn't move. And I'm pushing on it, and he's kind of giggling. He's kind of protecting his emotions because you either laugh or you cry. But again, you can just see there's so much different fascial motion than right here. And so this is one of the in-office treatments that we do that I'm excited to tell people about. What we're going to inject into this scar is a B vitamin that literally makes the the nerves open, close, and reset. So I just wanted to say hi on this camera here, and we're going to go through and just liberate the scar. So we're just going to slide underneath it, and you can see we're just going to separate that just a little bit, come on top of it. Yeah, it's perfect. Right through here. It's not very comfortable. Caden, is it painful?
Very, very, very painful.
Okay, we need to get another patient in here that's tougher. But the fun part is that it's worth it. So we're just pulling off the skin over the scar here, and it's going to make a world of difference as far as there's going to be no fascial drag. This is a pretty significant scar here that I'm so excited to see not only what it looks like in a couple weeks, but also how he's feeling. And so anyway, that is the scar treatment. I'm just going to wipe it off. I want everybody to kind of look at that. Actually, we got just a little bit more. I can see, sorry, Caden. We're going to bring it right over here. Okay, so literally, we're just going to clean that off. That's what a released scar looks like. There's fluid underneath it, but even now you can see that there's a better fascial plane. There's less fascial drag, and that is how we treat the scar. So, Dalton, if you can bring me back up to the screen here. Okay, you guys, that's literally how you treat scar tissue. Now, if anybody at home is looking at this, okay, there's some really neat ways for you to treat things at home. You can use aloe vera, you could use DMSO, you can use EDAP cream. I really like just a really again, aloe vera is one of my favorite. You can rub out that scar. I think the best effective way is to get those to release with that B vitamin solution. You just want to pull off the layer like that so you have less fascial drag. But if you have any chronic healthcare condition, you need to know about this, and you need to find a doctor that's aware of the entrapments from scar tissue, not only from emotions, but also from scar tissue, also from trauma. We can release trapped emotions. It gets your acupuncture meridians working better, in my opinion, and people will have really nice emotional and physical release from this therapy. So anything that you want to see, is I put it together in our report. Just type in #scars, or you can go to the link. But that is one of the most important healthcare things that I've ever learned about, is scar tissue and the release therapy. This is Dr. Jason West, Thursday nights at 5 o'clock. Next week, we're going to talk about the flu. So many people want to know what to do in the flu season, and they want to know, how can I get myself healthy? Should I get a flu vaccine? How come if I get a flu vaccine, many times I get sick? I'll give you my take on what we recommend for people, how we've been working with the flu since 1916. That's going to be our topic next week. If you want more information about how to treat scar tissue, pick it up in our scar tissue report. You can check out our patient success stories, their daily dose vitamin H. It's not just me saying it. We have hundreds. I think we're almost to 1,000 different patient success stories. We put them up on our Facebook and our YouTube channel. And that's how you treat scars. It's so important for health. Dr. West signing out. I'll see you guys next week, Thursday night, 5 o'clock Mountain Time. We'll see you about the flu. We'll see you guys then.